Our role here in the U.S. Consulate in Nigeria as the commercial service is to help facilitate and promote U.S. business activity in the market. The best method for U.S. companies entering the Nigerian market is clearly through partnerships like the one that Acorn has found with Jill, and helping them to navigate the regulatory process as well as identify the right end user customers and contacts here in the market. I think what Acorn brings to offer is the high quality and trusted pharmaceutical products that people look to when they're working in the health field. Health is obviously very critical to economic development, and I think what Acorn brings to the table as a U.S. manufacturer and producer is the opportunity to leverage those high quality products in the Nigerian market, which is a huge opportunity for both U.S. companies as well as their Nigerian partners such as Jill.
With Acorn in Nigeria now, this brings about a new dawn in pharmaceutical investing between the United States and Nigeria, especially when it comes to the private sector. What do you make of this?
I think companies like Acorn are leading the way. Small to medium-sized niche companies like Acorn that have been around a long time and are trusted, but maybe not the big names that people necessarily look to, are the ones that are going to be, I believe, the leaders in breaking into the Nigerian market and leading the charge, as well as opening up the market for opportunity for potentially others as well. And I think for their local partners such as Jill, it forms a tremendous relationship that can be built on moving forward, demonstrating to others what the opportunities really are here in Nigeria, maybe dispelling some of the myths, I think, that exist on the U.S. side about doing business in Nigeria.
The United States Embassy and its consulate in Nigeria is very well known for trade facilitation between the U.S. government and Nigerian government. Walk us through what is new in this process.
Well, we believe that economic growth is directly tied to trade and development. And so for us, helping to promote U.S. businesses and business relationships around the world in places like Nigeria helps to grow U.S. companies, U.S. jobs, and the economy. Simultaneously, it also helps local companies who are partnered with them to help grow jobs here in the Nigerian market. And so it's a win-win, I think, on both sides of the equation when you have open trade and investment between two economies. Our role is really to help facilitate the right introductions between the right partners to make sure that people understand what the process is, getting to market successfully, and to, I think, as I said earlier, dispel some of the myths that exist perhaps on both sides of the equation, but particularly, I think, on behalf of many American companies when it comes to Nigeria. There's a sense that it's a very difficult market. And so we're here to help them over those hurdles and help them to understand there are really tremendous opportunities here to grow the presence of U.S. products.
And in the meantime, Nigeria's exit from recession appears to be paving way for foreign direct investments as listed American pharmaceutical giant Acorn hits the Nigerian market through trade facilitation from the U.S. Embassy Commercial Unit. Now, in this interview with Channel's business producer Temple Ashaju, the Vice President, Mr. Mark Silverberg, explains how partnership with Nigerian companies is improving the business relations.
Part of our mission as part of healthcare to people of all ages continues to be people around the world. While originally our focus in the marketplace was primarily in the United States, we continue now to look beyond to many regions of the world where the products that we've developed and are having approved may have value. And so through our understanding of various markets, including the Nigerian market, we understand the need and have the mission to explore the partnership in Nigeria for those patients and customers that can benefit from these products. Oftentimes, a relationship is established on common goals and common interests. The types of products that we've developed and made have a common need around the world. And we have learned about that over the years. We have markets that we are now beginning to participate in other parts and other regions of the world. through our own employees and representatives, including Mr. James Adawu, we have become appreciative of the need in Nigeria. And in fact, one of the early steps in establishing this foundation is to invite the counterpart of the U.S. FDA, the regulatory authority from Nigeria, to our manufacturing facilities. And they have successfully visited our manufacturing facilities where these products are manufactured in the United States. The outcomes have been positive. And so we hope and we believe that there is a win-win opportunity for both the stakeholders and the patients in Nigeria, as well as for the Acorn family.
What has been your experience on the ease of doing business in Nigeria?
I would say, from my perspective, that the importance of establishing a successful opportunity is learning the parties with whom you are communicating. Acorn has had some early experience with partnerships elsewhere in the world: China, India, Europe, South America, the Far East, and now Nigeria. And so we appreciate the fact that each market has its own set of rules, its own interests and priorities. And so we've learned from past experience to listen to what the priorities are, in this case for the Nigerian marketplace. And through our team, we've come to appreciate not only the medical need, but the need for volume of product once it's available, the regulatory requirements that must always be satisfied, the customs expectations, etc. And our mission is to establish this relationship to make the product available and affordable with no compromise to product quality.
As part of your expansion plans, do you plan to manufacture some of your products locally?
I would say, having been asked that question recently, anything is possible. I do not represent the Acorn team in answering that question, but from a personal experience, I will share with you that since coming to Acorn in 2005, today we are well beyond anything we could have imagined in 2005. We have 10 times more products. We have 20 times more revenue in the sale of those products. We are in markets well beyond the United States. We recently, in recent years, purchased a large facility in India for manufacturing, one in Switzerland just a couple of years ago. These were not imagined 4 or 5 or 6 years ago. So my answer is anything is possible if the need and the justification is there. From a quality perspective, our key contribution will be affordable, high-quality generic product, both ophthalmic products, which are sterile, and injectable products, which are sterile. In today's presentation and at the meeting we're having today, I learned, for example, there are questions about a number of other products beyond those that are part of this product launch. We make them. We market them at home and abroad. And so perhaps a second step after the launch of these 7 important products would be another group of products that might be of interest to the Nigerian community. And of course, as I mentioned before, the focus here, with no compromise to quality, always the highest level, is to make it reliably and affordable in such a way that it can be delivered without compromise for use by the end user.
Now, Acorn is a listed pharmaceutical giant in NASDAQ. What's been your experience as a listed company, and what do you think that pharmaceutical companies in Nigeria can benefit, can learn from you being a listed company?
Accountability is very important. As a public company, we are traded on a public exchange, stock exchange. It's called NASDAQ. So we are accountable to shareholders, regulators like the FDA, like the authorities here and in Europe and elsewhere. We're accountable to our own employees, and most of all, we're accountable to the patients that use our products. That is a common thread, not only with Acorn, but any other publicly traded pharmaceutical. Prior to coming to Acorn, I had the privilege of working with Abbott Laboratories for 30 years. Learned a lot there, continued to learn here, continue to learn from our new friends in Nigeria, and the learning process is a very important piece of understanding the business needs and the medical needs for the products that are needed in any part of the world. And so our quality program and our management approach is to listen, to understand, and to seek where we can have that win-win relationship. Our products that may serve the needs of the community anywhere in the world. I can't speak for the Nigerian community, but I can assure them that every unit of medication that comes from our manufacturing facility to Nigeria is identical to any unit that is provided in the United States, in South America, in Europe. They are the same. And as I shared in the other room, some personal stories and some orientation of our thinking. If it's a child or an elderly person in New York or in Nigeria or elsewhere in the world, they receive the same product under the auspices of one quality system. We use the same quality standard for every unit of product that we make. Once again, the entrepreneurial nature of our company has been where there is an emerging need for a disease state that we may have some capability in. It's something that we would look at in our product planning and development pipeline. So I'm not aware that we have that as a project currently, but we have always been open to new opportunities in ways, again, to satisfy a win-win relationship.
In the meantime, the ongoing industrial actions of Nigeria's Association of Resident Doctors and other related bodies is leaving a toll on pharmaceutical investment. An industrial pharmacist, Mr. Benson Ugumbamiwa, explains that the cost of such actions on prescribers is putting investors at the beck and call of lenders.
You have industrial actions, a lot of we call them POM, prescription-only medicines, which the doctors, the prescribers are supposed to, after doing their due analysis of the pathophysiology of disease conditions, they make their appropriate prescriptions. That helps to save costs because the patient actually gets the right prescription for the ailments and can just go to the pharmacy with the minimal amount, get the drugs needed. But now that the prescribers are not, the doctors are not working, especially the resident doctors are on strike, you know that the patients are at the mercy of charlatans as they go from one store to the other, and a lot of them will not even go to where you have registered pharmacists and pharmacists. They go to these quacks who are not even licensed to sell prescription-only medicine, and you just can imagine the impact of that on our economy.